Everyone, hope you all are doing well and staying safe. Today I'm here to talk about anxiety. Now, anxiety is the most persistent mental health issue, but not as much reported as schizophrenia, depression, bipolar disorder. In we all know, we all have anxiety in our normal situation whenever someone is going for an interview or there is some presentation or exam anxiety. Sometimes it's when we are going away from someone, we have anxieties. But there's different between this anxiety, normal routine anxiety, and anxiety disorder. As in this, we tend to go from into anxiety and then out of anxiety, but in anxiety disorder it's very difficult to get out of that space of anxiety. Now, what are the symptoms of anxiety? In anxiety, you feel breathlessness, you feel anxious, you feel restless, you feel like your body is trembling or shivering, plus there's heart palpitation, your heartbeat is faster, then it's difficult to concentrate on any work you are going to do. You're being distracted, you're continuously going through negative thoughts, you're continuously thinking about negative aspect of everything. Now, anxiety can be of many different kinds. There is generalized anxiety, which is not related to any specific event. There's specific anxiety, which is related to specific thing, situation, or anything that's very specific. Then there's social anxiety. Social anxiety, it's difficulty having to present something in front of people and talking about your opinion. You fear being judged because anxiety is full of fears and negative thoughts. Then there is also separation anxiety, in which especially when this child is growing up, he has separation anxiety while starting his nursery or going to school away from his mother or away from their home. They tend to have a little bit of separation anxiety. Now, the anxiety disorder is only diagnosed when this condition is persistent and your daily functioning is disturbed. Like for example, I'll discuss about one of the case I have seen. There was a person who was unable to sit down, and he was continuously moving his hand and saying that I'm feeling anxiety, I couldn't do anything. What should I do? He was unable to stop his body. His body was continuously rocking, and he came in and couldn't sit down because his anxiety level was very high, and he was fearful about different kind of things, or he was continuously having negative thoughts. Now, this anxiety affects children, adolescents, and according to many researchers, the anxiety problem is more in older women than older men. Like, not only children, adolescents, or adults suffer from anxiety, but even in old age, people tend to suffer from anxiety. Now, we have to know the anxiety before we can go for treatment, as if we don't know what are the symptoms of anxiety and how we diagnose it, like until and unless it is persistent for a few weeks and it's not going away, then only you can be diagnosed as having anxiety disorder. So take lot of care, keep a check on yourself, your thoughts, and if there is any problem in your thoughts, or in you're more tend to think more negative than the positive stuff, and you're fearful about many events which are not even like occurring in present, then you need to go for mental health professional, need to go to mental health professional. Now some people are like confused about what is panic attack. In panic attack, it's similar to anxiety disorder, but in panic attack there's sudden body changes, like suddenly you feel that everything is going to collapse. You start having negative thought in that moment, and your heart palpitation increases. Then your breathing, you have problem in breathing normally, and at that moment you can't do anything else than to focus on the negative stuff, or having thoughts about anxieties and the situation. So you have to be clear about anxiety disorder. It's very common, and you have to keep check on it. But in natural, there we all have anxiety naturally, and this natural anxiety is healthy for us, because if we won't have any anxiety, we won't be able to perform well or achieve our goals. Like for example, during exams you have anxiety. If you don't have anxiety, then you won't struggle for it, you won't try to score more marks. Even in presentation anxiety, if you don't have anxiety, you won't practice or do anything for your presentation. You will be like relaxed, like let's see what happened. So this anxiety is healthy, but when it goes out of your control, that's the moment you have to go to mental health professional. So take lot of care, and keep record of your thoughts, so you can keep check on your thoughts. Take care of your physical as well as mental health. So I'm signing off. Take lot of care. Thank you.